quarantined at home and you're on steroids or TRT. I want to try to keep you strong and healthy. Currently, we are under world pandemic emergency all over this world. It's unbelievable. It's true. You're ordered or you are at home because you know you need to stay home because the primary weapon we have against this virus is not catching the virus. So you need to stay put. And we certainly understand the consequences of what this is going to do to us. Hopefully not for years and years. Hopefully we can knock it out quick, and that could be hopefully within 2 months. That's my medical opinion at this time. So, if you are one of the tens of millions of men that are currently taking anabolic steroids, or even a testosterone replacement regimen from a physician, or you're giving it to yourself, you're going to be at risk for some unique medical complications. I'd like to discuss these today with you and to provide you with a preventive plan. This is so important. I want to discuss what we can prevent so you don't go into the hospital, because the hospitals are not going to be a place that you want to go to right now. Number one, they're going to be overloaded. Number two, you could get sick if you go in there. Number one group that I have to reach out to and discuss is if you are a man, you are asymptomatic and you don't have any current medical conditions like a heart attack that you know of or a stroke in the past, you're a young person, you're on steroids or even TRT. What happens? Obviously, common things. We have to prevent you from having a heart attack, having a stroke, DVT or pulmonary embolism. Men that are on testosterone and men that are on steroids definitely, potentially have an increased risk of forming a clot in the lower legs. I see it all the time, guys. We don't understand. There's genetics. If you have a hypercoagulable family history, someone in your family history, your mother, your father, sister, or brother has a clotting disorder. They've had DVTs and PEs. You guys, I know you know what this is. And then you're sedentary now because you're at home. You're on androgens, definitely, and you have polycythemia, the red blood cells go up. There's no data for any of this stuff. I just see it. I'm laying out the worst case scenarios. That's why I'm going to tell you what you can do to prevent this. So DVT, PE, you don't want that because that happens all the time anyway. So if we can prevent it during these next couple of months, to stay out of the hospital, you're going to be better off. Infections. If you're injecting testosterone, even not to mention intramuscular steroids, everyone knows that you can get an infection. It can turn to cellulitis. Please be careful with that. Can you imagine you get an infection? We can call an antibiotic. I call antibiotics in for men all the time for injections for testosterone, even steroid users. It's the appropriate ethical thing to do. Sometimes the antibiotics we call in either don't work or it's too late and you'll need to go to the hospital for intravenous care and maybe surgical care. Could you imagine that could be something so easily to prevent right now? If you're taking intramuscular steroids, you can get infected. We're going to talk about what I'm recommending if you're on steroids or TRT here in the end. Injuries. Don't get injured, so be very careful. We'll talk more about that in home training. Monitor your blood pressure. You haven't had a stroke or a heart attack. Monitor your blood pressure, I think, is the most important thing. Be aware of your heart rate. If your heart rate is screaming and your resting heart rate is over 100 beats per minute, there's something wrong. You're going to want to talk to a doctor now before maybe this thing does get worse and deal with that at home. Labs. Emergency labs and labs that are always relevant are the basic labs. CBC, if you have polycythemia on top of the genetics, on top of the antigens, could you have a problem with a stroke? The data is weak on this. We don't know, but it does happen because the moons line up. Can you get a DVT because your red cells are very, very high on top of the antigens, on top of your genetics, on top of your sedentary behavior? Kapow, DVT, PE, you could suffer. I see it every day. There's so many independent variables. Please. So you want to get a CBC, you want to watch the blood pressure, you want a comprehensive or a basic metabolic panel, liver, kidney, heart. You see what's going on? You want to watch that. You want to make sure you're aware of what's going on with expert medical advice. I'm offering telemedicine services now fully across the world. Urinary analysis. If you have, this is typically for middle-aged or older men, if you have prostatitis or if you have a history of urinary tract infections, you can get worse. You can get uroseptic. You can stay out of the hospital. If you have it, you look at a UA or hear your symptoms, we can just give you antibiotics and keep you home. Basic things save lives. Basic. What labs do I not recommend focusing on at this time? Non-urgent labs. It's not that I don't care about lipids, but I don't want anyone starting any new medicines right now, even for cholesterol, unless it's outrageous and you already have access to a doctor's care. Total and free testosterone, DHT levels, prolactin, ultra-sensitive estradiol, PSAs, thyroids. It's not that I don't think these are relevant and important, because this is the backbone and the basis of what I do all day long. This is an emergency period. We don't want to be tying up. I'm getting labs set up all over this country for basic things, and I'm following some of these very important quality of life things, and some of these are very relevant, of course. But for you that have limited access to medical care, the basics are what you want to do, so you stay out of the hospital, you stay out of medical clinics unneeded. If you started new medicine that you really may not have needed, or you could wait to start a new medicine at another time. If you have a bad reaction, we see it all the time. If you have an allergic reaction, that could cause you to end up in the hospital or calling 911. Okay, if you're on anabolic steroids, there's two groups. You've just started anabolic steroids, you think you can come off because you're not going to have withdrawal syndrome. You know that. You just started. You're never done steroids. Don't do steroids now. So many calls are coming in. Please keep the calls and keep the comments coming in. I love it. It's not the time to start a steroid cycle. I don't recommend ever starting a steroid cycle, but during this time period, this is an emergency. We have to cruise through this period and keep people out of the hospitals. That's the number one goal of this video, staying out of the hospital. So don't start steroids. If you are on steroids, you can't just stop. You need to wean down for the sake of withdrawal syndrome and anabolic steroid-induced hypogonadism. We have tons of data. I'm one of the experts in the world that I've noted this, and I've been ringing the bell on this for over a decade. Men that are on steroids for a considerable period, men, it's going to be man per man. My guess is you know who you are. You're on steroids for years and you can't come off. You need to be transitioned to TRT. Maybe during this time period, if you have proper access to me, to other doctors, all telemedicine services, can you transition safely and cruise on TRT? This is the time to cruise, guys. No blasting. I don't want to see blasting. It's too dangerous during this time period. Yes, we can use HCG, selective estrogen receptor modulators, and selective use of aromatase inhibitors. I use Clomid, tamoxifen, HCG, and AIs, case by case all day long, and I use testosterone to wean men. We have data for this. There's no supply chain problem right now. We don't need to hoard testosterone. Now, people are hoarding antibiotics, blood pressure medicines, heart medicines. This is what's happening. Thank God no one's hoarding testosterone. I don't want to say, hey guys, keep it down, but it just is what it is. So if you stay home and we can keep you on testosterone appropriately if you need it, if you don't need it, do not start it. That would be smart to keep you cruising, not blasting. Last part, training at home. Everyone is obviously home. We're quarantined, self-quarantined in certain circumstances. We're being forced to be quarantined. You could still ride your bike appropriately. You could still take a walk in the woods. You play with your dirt bikes. These are all the things I love to do. Risk management. Imagine you got hurt I'd love to climb and jump off of that rock today, and I have to talk myself out of it because I can't get hurt. You can't get an injury and go into the hospital. Please respect local laws. The gyms are closed. Some people are going to have small group training in the house. Some guys, every guy who's got a cool gym at home or any home gym, he's getting hammered by his buddies. So common sense now, common sense. You want to screen the partners. You want to be careful because unfortunately this virus spread is so much with asymptomatic. You could ask, do you have a fever? Do you have upper respiratory symptoms, fever, cough? Are you in contact with someone? That's common sense, but there's still going to be a lot of asymptomatic cover. Guys are going to come over, you're going to spray down everything, but are you really going to spray down your Texas Power Bar with tons of bleach and then you're going to lift with that? This is common sense. No one knows what to do. So limit the contact with anyone, because if you imagine you bring it home to someone you love, maybe your parents, someone who is immune compromised, there's even young people getting hurt from this. And this is not media bullshit. This is the truth. So use your telemedicine services. I'm offering it. Get those consults cooking. I'm sitting here in Connecticut. We're protected. We're safe. Everything's full bore. I'm working around the clock for you guys. Next group. You're on steroids or testosterone even, and you have underlying heart disease, congestive heart failure, chronic kidney disease, maybe you've had a stroke, maybe any kind of cancer in the past or currently, diabetes, COPD, that's emphysema and chronic bronchitis, maybe you're a cigarette smoker, asthma, severe asthma, maybe you're a transplant patient, maybe you have one of several rheumatologic conditions, rheumatoid arthritis, inflammatory bowel disease, Crohn's disease, ulcerative colitis. I have patients with all these things. These are very common medical issues. If you're on immunosuppressive regimens of any kind with corticosteroids or chemotherapy, we're going to have to look at you primarily and make sure that you don't have a reoccurrence and you can get sick. We have to keep everyone out of the hospitals. Number one, you need to make sure you have enough medicines for your underlying conditions, please, and I think everyone knows that already, and you need access to your doctors. Telemedicine is wide open now. The feds in the states, governments have opened up telemedicine appropriately. I've been doing telemedicine for many, many years with a HIPAA-approved platform. Now they're just opening it wide open because you have to stay out of the hospitals and even clinics with antibiotics, blood pressure medicines, any medicine, any medical advice that we can give you to keep you out of the hospital. Here's what you have to do, men, if you've had some of these medical conditions, a heart attack or stroke, anything in the past, chronic kidney disease, you have to monitor your vital signs. Blood pressure is so important. Please really understand how to monitor that with a home monitoring machine. If you haven't done it before, please learn it now. Blood glucose. Obviously, you want to make sure if you're on insulin that your levels of glucose don't go too low. That's going to be complications. Talk to the nurses, talk to diabetic experts and teaching experts about this if you're not already aware of that. Next, you want to prevent a secondary event. Heart attack. You can't have another heart attack during this period. We have to make sure it doesn't happen. Stroke, diabetes complications, as I've mentioned. This is why people that have underlying medical issues go back to the hospital. I think the most important thing is to make sure that you understand your condition, call your doctors, have your medicines, have the plan in place, and make sure you stay home and you're stable. Please spread this video to everyone in the world that's on testosterone or steroids or considering taking steroids. I really hope this helps. Thank you so much. We will get through this.